Hi everyone, welcome back to the Fetal Center at Children's Memorial Hermann Hospital's Facebook Live event for World Spina Bifida Awareness Day. We have Dr. Kojin Sao with us. He is one of our co-directors with the Fetal Center and also a professor in the Department of Pediatrics here at McGovern Medical School with UT Health. He is here to help us answer some common questions about spina bifida and also talk to us about services provided in the Fetal Center. And just as a friendly reminder to those watching, parents, we do want to hear from you, so if you have questions, comments, anything, message them through. We're watching it live, so we will be able to answer back any questions that you guys have. You have these few moments with the experts here. It's a rare opportunity, so take advantage of it. All right, without further ado, thanks Dr. Sal for being here. I really appreciate it.
No problem. Thanks
so,
for having me.
Yeah, if you can kind of start off telling us about spina bifida, how common is this condition?
Yeah, spina bifida is, when we say common, it's still pretty rare. It's about 1 in 1,000 births. We see a fair amount of it because of the kind of hospital and fetal center that we are. People usually send those patients to us for evaluation. In the spectrum of all the other birth defects in the world, it's one of the more common ones, but it's still pretty rare for the common folks.
Perfect. We know that there are multiple forms of spina bifida. Can you tell us a little bit more about that and the differences between?
Yeah, so spina bifida essentially is where the spinal cord fails to develop properly. And so through development, it's actually a long tube and it actually closes up on itself. And at some point during the development, the spina bifida decided it wasn't going to close up completely. Now that lack of closing up completely, not only is the bones and the vertebrae around it, but actually the spinal cord that comes down the middle of it. So the most common kind we see is called myelomeningocele, which is essentially an outpouching of the back. And sometimes it can have skin covered to it, and sometimes not, but essentially it's kind of a hole in the back, and all the spinal fluid can leak out from it. And there's other variations of that. Sometimes the spina bifida is just a hole in the back that is pretty flat, and that's called a myeloschisis. And sometimes we have covered myelomeningocele or covered spina bifida. That essentially is just the anatomical problem, but it doesn't necessarily cause any problems for the patient. We think that spina bifida causes problems because not only is the spinal cord not properly developed, but it's also exposed to the amniotic environment. So the fluid that's in the amniotic fluid actually can damage the cord. So it's actually what we call the two-hit hypothesis of what causes the problem. So not only is there neurodevelopment, or the nerves don't develop properly, but then they get exposed to toxins in the amniotic fluid that causes further damage. And so the ones that are covered with skin are actually protected from that second damage. It's the ones that are exposed that have the hole are the ones that we feel need to be treated sometimes before they're born.
Awesome, thank you. Can you talk to us a little bit about the available treatment options for patients that are referred to the Fetal Center with spina bifida, traditionally how is spina bifida treated, and also the in utero options?
Sure. Every patient that comes to the Fetal Center gets a full evaluation, meaning they get a full anatomic evaluation with ultrasound, MRI, and we see them as a team, not only as our maternal fetal medicine colleagues, our neurosurgeons, pediatric surgeons, our pediatricians that are spina bifida experts, our genetic counselors, social workers. So everybody sees these patients. And so the workup is pretty extensive, and that really leads into a long process about counseling. We feel that it's our duty really to educate families on what spina bifida is. They usually get a diagnosis. They don't know anybody in the field because they only know their obstetrician. And so we bring all these experts to the patient so that they can be educated, because it's really going to be a condition that they have to live with, or their child has to live with for the rest of their lives. Once the evaluation is complete, then we really lay out their treatment options for them. Traditionally, repairing the spina bifida is really an after-birth operation. Babies are born usually at term, usually by a C-section, and then within a day or two, the neurosurgeons will repair the defect on the spine in several layers, and that's the traditional method of fixing those. What we do here is a little bit different, and we offer a different option to patients, but only for those that really are truly qualified, that we think are the best candidates for that, and that's fetal surgery. Meaning that we are going to take that operation and do it even before the baby's born. and that's usually about 22 to 26 weeks, somewhere in that time. We feel that if we can treat the problem ahead of time, and maybe some of that ongoing damage from the amniotic fluid and stuff won't really happen. But it's really for a select group of patients, but we don't know those patients until we actually can see them, evaluate them, and counsel them properly.
Perfect. Thank you for that. Can you tell us a little bit about the MOMS trial and how significant the results of the MOMS trial were for treatment of spina bifida?
So the MOMS trial is the government-funded clinical trial that really was comparing standard treatment, like I mentioned, operating on the babies and fixing their backs after birth, to fetal surgery. And the MOMS trial came out a few years ago, but really it was in the works for, at least from a clinical trial standpoint, about 10 years. And then all the work up front before that was probably another 10 years. And so fetal surgery for spina bifida actually been around for about 15 to 20 years. We were lucky enough to be associated with some of those centers that finished the trial. And what the trial really showed us was that if we can tackle some of these problems before the baby's born, there are some advantages to the baby when they come out. One is that at about 2.5 years, they seem to walk better. There's a higher percentage of kids that can walk independently. And the other aspect is that they have a decreased chance of having a shunt. And a shunt is really draining the excessive fluid from the brain into the abdomen. And that's one of the problems of spina bifida, is that not only do you get the lower body problems, all the nerve damage to the legs and the bladder and the bowel function, but they develop this thing called a Chiari malformation, and that's where the brain sinks down into the lower part of the skull and the upper part of the neck spine, and it creates a blockage, and all the fluid in the brain sort of swells. And so what fetal surgery is intended to do is not only do we repair the back, but it kind of releases the spinal cord, allows that brain to kind of float back up, relieving that pressure. And so about half the kids that were expected to have a shunt end up not needing a shunt from the results of the MOMS trial. Now, that in itself is pretty significant because it really took a pretty high-risk operation and really laid out all the details and allowed us to provide evidence to families that this is something that is reasonable. It gave us information and data about balancing the risk for the baby, but also to balance the risk for mom. It's an operation where moms undergo a big operation. We open up mom, we open up the uterus, expose the baby. Our neurosurgeons come and repair the back, and we put the baby back, and we want the babies to stay pregnant, or the moms to stay pregnant for the rest of their pregnancy. And so it's really allowed us to really counsel our patients properly, but also gave us the evidence to say this is a good thing. Now, the other major aspect of the MOMS trial that's really different for everything else that we do in fetal surgery was this was the first operation really that we were treating problems, what we call morbidity, which is problems that are really consequential to the patient or the baby, their inability to walk, they're having shunts. But these conditions aren't really life-threatening. So spina bifida is not a life-threatening condition, where traditionally fetal surgery was only reserved for what we thought babies were going to die from whatever complications that we're having, and that it was really a heroic effort to put mom through all this risk to have fetal surgery. And so this really changed the way we looked at things, and we're dealing with problems of decreasing morbidity instead of decreasing mortality, and that really changed the way that fetal surgery is really looked at around the world.
Perfect. I know that for some of you guys watching out there, and I know one of the major questions we get from both patients calling in and referring physicians calling in is, what is the qualifying criteria for fetal surgery? I know that that is just an area that we constantly hear about, so if you could talk about some of those, that would be really helpful.
It gets a little complicated sometimes. It's not all that straightforward. In our website, we lay out the really criteria in which patients should qualify for fetal surgery. And essentially, it's the same criteria as the MOMS trial. And that's a situation where all the centers that are doing fetal surgery for spina bifida really have agreed we're not going to depart from what the MOMS trial showed us works unless we're going to do it under a research protocol. But the major thing really is thinking about, and it's the way I talk to patients, is there's all forms of spina bifida. There's kids that probably have very mild spina bifida, never will have a problem. And there's kids that have very devastating spina bifida. By the time we see them, we see evidence of all the neuro damage that's already there. They're not moving their legs. They have a really bad Chiari malformation, things like that. And so it's really a balance, because the ones that are really mild probably isn't worth the risk of putting mom and baby through fetal surgery to fix, because they're not going to gain that much from it. They weren't going to have that much problems. The ones that we've already seen that, for example, aren't moving their legs already, we know that they're not going to walk. That's another group of patients that we wouldn't offer fetal surgery to, because the damage is already there and it's not worth the risk, because we can't fix anything at this point. So it's really that middle group of patients that have bad enough spina bifida, but not necessarily have shown the damage that's already there, that we think that we can help.
Absolutely. So, does the Fetal Center strictly follow the mom's trial criteria protocol? I know that we've recently made some advancements and changes with BMI. If you can talk about that.
Yeah. So, it's about valuing the risks and the benefits, and so what the mom's trial gave us was really the data that we can really weigh the risk and the benefits. And so, but that's under clinical trial, sort of the rigors of a clinical trial. And so as we get more information and fetal surgery becomes a safer option, we're always reassessing what those risks are. And so one of the major sort of reasons you didn't qualify for spina bifida surgery, fetal surgery, was that your body mass index was too high. And body mass index is about your size. And we know that larger size patients usually have higher complications. And so right now we have a clinical trial of our own looking at a higher group of BMI, or body mass index, to see if those patients are have the same risk profile as the ones in the mom's trial. So, but we're only doing it really out of research protocols really at this point.
Thank you. And I'll have to say that after the publication of the mom's trial, I believe that the Fetal Center team here at Children's Memorial Hermann was one of the first in the country to perform the in utero spina bifida repair. Dr. Kojin Sao was a team kind of vital member of that first surgery. So if you can tell us a little bit about that experience for you.
Yeah, it was a tremendous experience. We when the mom's trial became published, we felt like there was something that we really should look into and offer to the patients in the southern part of the United States. The three moms centers were essentially on the West Coast, sort of in the Midwest and the Northeast, and so there really wasn't an option really in this part of the country. We were lucky enough really to have colleagues in those centers that were very supportive of us, and so even though we had never done a spina bifida fetal surgery before, we felt like we had the expertise with some of our colleagues that we had, with the training that we had at those centers. And so what it really was is an experience of really a leap of faith, if you will, knowing that you had to find the right patient to say, I'm going to go to a place that's never done this before, but know that they've done all the parts, but not sort of all together for this particular operation. So it was a very humbling experience, because it was our ability to do something really by learning and training just like you're supposed to, doing things in a way that is very scientifically driven, and seeing that it eventually works from that standpoint. I think the other aspect of it is that it really put a testament to the kind of folks that we work here. Certainly doing this kind of work is a little bit out of the box of what people normally do. And going through that experience, you realize, what people are willing to maybe step out of their comfort zone briefly, to learn, to accept a potential option because we think it's the right thing to do for patients, and be able to do that in a team fashion and really work together. I think that was really part of the experience of doing that.
Awesome, that's great. Well, I'm sure that there's a lot of moms out there watching this, wanting to know, maybe they're not pregnant, just trying to get more education. So what is important for expecting moms to know, and when is spina bifida diagnosed in pregnancy?
Yeah, so spina bifida, the best thing about an expecting mom, one is we know there's risk factors, and that is folic acid. And so when your obstetrician tells you that you got to take your prenatal vitamins, it's really something that this is one of the reasons why. But once you sort of become pregnant and this becomes an issue, there's screening tests through blood tests but also the prenatal ultrasound should be able to pick these up, in the early first trimester or the beginning of the second trimester. Once that happens, and once you're kind of given the diagnosis, the best thing that parents can do really is to educate themselves and to find out everything you can about the disease, because you are the one that is going to be taking care of your child for the rest of their lives. And then finding out what are all the options that are available to you to maximize sort of the growth and development of your child. And so that is part of our responsibility. We offer fetal surgery, and we probably could have just said, we're just going to talk to you about fetal surgery. But we felt that was very unfair because, parents come to us with very limited knowledge if you're not in the medical field.
Yeah.
And so we've spent a lot of time and effort creating educational videos. We talk with the families with these models. We sit down for hours and we go over their images, and so that at the end of the day, even if they don't qualify for fetal surgery, they've learned about spina bifida, and then they can connect with the doctors that will be taking care of their child after the patient's born.
Awesome. I think one thing we want to highlight here at the Fetal Center is that obviously from talking with our different physicians, we take a multidisciplinary approach to every single patient to give them the most comprehensive evaluation as well. And while they get all that information, one key component of our group is research, and I think that is the backbone of who we are and what we do here at McGovern Medical School with the Fetal Center and Children's Memorial Hermann Hospital. So if you can take a moment to talk about
Sure.
what we're doing to advance the treatment options for spina bifida, long-term goals of the research we're doing here.
So not only are we interested in obviously taking care of patients and bringing sort of the most up-to-date options for families, we have spent a lot of resources, time, effort, funds to really look at how can we really even decrease even more the problems that these kids have. And so a tremendous project that we're putting together now that is kind of getting into clinical trials is by one of my partners, Ramesh Papana. Dr. Papana not only does the fetal surgeries with us, but he has a lab that we're looking at different types of patches that we can use to help close the spina bifida. One of the problems that these kids see is that they get scarring in the areas of where the spina bifida is closed. And so they may not have a problem right away when we fix it, but maybe a year or 2 years, 3 years down the line, that scarring is going to become a problem and called tethered cord. Is there an alternative to what we're doing currently that really can minimize that risk of developing that problem? And so we've done a lot of work in trying to take that product and put it into humans and offer it to patients that really would need that kind of a patch. But we've done it in a very stepwise way. We've done it by doing it in the lab, doing it under the microscope, and then doing it in animal models and sheep and different sort of models of spina bifida, and then finally felt like it was ready to be offered to families. And so here we can offer this sort of alternative to traditional patches under a research protocol as well.
Awesome. So I know it's really, really exciting for all of us.
Yeah.
So perfect. I think we do have some live questions coming through. I'm going to pull these up. All right. Okay, here's the first. Can you list quality resources for patients to educate themselves? Where can I find links to literature and videos that Children's Memorial Hermann provides?
Yeah, so we spent, you'll have to remind me how long it took us, probably 2 years at least,
Quite a while.
putting together what we think is a pretty good patient education video. And if you log on to our website and go to the spina bifida section, you will see a very animated video that really talks from the very beginning. Not only talks about how the condition is diagnosed, it talks about the development and why it occurs and the rationale behind the various treatment options that are there. We talk about the outcomes of sort of normal surgery or postnatal surgery. We talk about the outcomes of fetal surgery. And our response to that video has been tremendous from our patients.
Absolutely.
Before they come and see us, we always tell them, please watch this video. And so they become more educated and they really can ask a higher level of questions and stuff when they come and see us. After we spend the 2 or 3 days doing counseling and evaluation here, we always ask them to go back and watch it again. It's a little long, so you can watch it in parts that you have questions about, but we think that's a tremendous resources for families we provide.
Perfect. One other question that just came through, I know we had a chance to speak briefly with Blair earlier, our genetic counselor, but one of the questions we have is, can spina bifida be passed on, so it's the genetic implications of spina bifida?
There is. We actually have had families that have had siblings that have had spina bifida. Now, if you ask me, is there a specific gene that I can be tested for and whatnot in my family, that kind of answer is really not known at this time. We do know that there runs in families to some degree, but it's not a dominant gene, meaning that if I have it, I'm going to pass it down to my son or my daughter. And so, but nonetheless, all the patients get genetic testing and counseling when they come see us. But we do have some patients that have it run in their family.
One other question that just came through, and I think that this is a great question because I know as a non-clinical person, if I was a mom here in a consultation, you hear kind of a bunch of different terms. You hear myelomeningocele, spina bifida, neural tube defect, and the question just came through is, what is a neural tube defect?
I think all those words kind of all mean the same thing.
Yeah.
In fact, we kind of use them interchangeably around here, which kind of drives me crazy a little bit sometimes. But if you talk about spina bifida, you talk about myelomeningocele, meningoceles, you talk about neural tube defects, they're kind of all in the same, we use them interchangeably, so you wouldn't go wrong if you use one word or the other. So.
Perfect. That helps. I know that's something that a lot of moms definitely. I think we've got a few more questions coming through. Okay. All right. What is it about cognitive delays in kids with spina bifida?
So there's probably a couple of different theories as to why it happens. One is that probably there is some what we call global development of neurodevelopment. So we focus on the back and the spine, but probably at some level there's some developmental issues throughout the whole nervous system. But the other one is probably related to some of the consequences of the spina bifida, meaning that if you have hydrocephalus, which is a consequence where the fluid builds up in the brain from the Chiari malformation, we know those kids probably will have some developmental problems. You have to treat that with a shunt, and we know that every time the shunt becomes infected or has a complication, that also will affect the child's development. And so we recognize that as a tremendous problem. We don't necessarily have all the data long-term from fetal surgery, but the rationale is that if we can fix these things early enough that the Chiari malformation doesn't necessarily develop, that children don't have to develop a shunt or need a shunt, then maybe all of these things add up will improve their ability to develop normally. So.
Perfect. All right. Well, that's I think we've caught all of our questions that have come through. Just want to take a moment to say thank you to Dr. Kojinsau for taking the time to spend this with us and bringing awareness and education to World Spina Bifida Awareness Day. This has been a great event. Thank you everybody out there for watching and learning, and we appreciate you. So have a great day.